On March 1, 1864, in the final months of a nation at war with itself, a black woman crossed a threshold no one in America expected her to reach. Her name was Rebecca Lee Crumpler. On that day, she became the first black woman to earn a medical degree in the United States. This achievement did not happen quietly, and it did not happen easily. It happened against a backdrop of slavery, war, racism, and a medical establishment determined to exclude women, especially black women, from its ranks. Yet despite all of this, Rebecca Lee Crumpler became a doctor. And more importantly, she became a healer in places where healing had been denied. This is not just the story of a first. It is the story of a woman whose life reveals how brilliance survives, even when history tries to erase it. A world that was not built for her. Rebecca Davis Lee was born in 1831 in Delaware, a border state where freedom and bondage existed side by side. The United States was still decades away from abolishing slavery. Black people, especially black women, were systematically denied education, professional training, and legal protection. Medicine, in particular, was considered an elite and exclusively white male profession. Women were widely believed to be intellectually unfit for scientific study. Black women were rarely acknowledged as patients, let alone practitioners. Rebecca's early life unfolded within these limitations. She was raised primarily by her aunt, a woman known in her community as a healer. This aunt had no formal medical degree, but she possessed something equally powerful: knowledge passed down through experience, observation, and necessity. In black communities barred from hospitals and physicians, healers like Rebecca's aunt were often the only source of care. They treated illness, delivered babies, and comforted the dying, not for recognition, but for survival. From her aunt, Rebecca learned a lesson that would shape her life. Medicine is not about status, it is about service, a calling, not an ambition. As a young woman, Rebecca moved to Massachusetts, where she began working as a nurse. Nursing was one of the few medical roles available to women in the mid-19th century, though black women were frequently excluded or assigned the most dangerous and undervalued labor. For nearly 8 years, Rebecca worked as a nurse, caring for patients across socioeconomic lines. She witnessed suffering caused not only by disease, but by neglect. She saw people turned away from care because of race, poverty, or gender. During this time, several physicians she worked alongside noticed her clinical insight, discipline, and skill. They encouraged her to pursue formal medical training, an extraordinary suggestion in a society that did not believe black women belonged in medical school. Rebecca did not pursue medicine for prestige. She pursued it because she had already seen what happened when care was withheld. Entering medical school. In 1860, Rebecca Lee was accepted into the New England Female Medical College in Boston, the first medical school in the United States dedicated exclusively to educating women. This alone was groundbreaking, but Rebecca's presence made it historic. She was the only African-American student enrolled. Medical education at the time was grueling even for white men. For women, it was hostile. For a black woman, it was isolating and often openly antagonistic. Historical records indicate that Rebecca financed her education through the Wade Scholarship Fund, established by abolitionist and U.S. Senator Benjamin Wade, who supported the education of women and formerly enslaved people. This detail matters, because it reminds us that talent alone has never been enough. Access has always depended on who controls opportunity. Rebecca Lee Crumpler did not gain admission because the system welcomed her. She gained admission because she persisted, and because a few allies chose to challenge the status quo. Graduating during the Civil War. On March 1, 1864, Rebecca Lee Crumpler graduated as a doctoress of medicine. The Civil War was still raging. The Emancipation Proclamation had been issued, but its promises were unevenly enforced. Millions of formerly enslaved people were free in name but denied housing, education, employment, and health care. Black Americans were dying from illnesses that were preventable. White physicians routinely refused to treat black patients. Hospitals barred them outright. Rebecca could have chosen safety. She could have opened a small practice in Boston and lived quietly. Instead, she chose purpose. The Freedmen's Bureau. After graduation, Dr. Crumpler traveled to Richmond, Virginia, to work with the Freedmen's Bureau, a federal agency created to assist formerly enslaved people during Reconstruction. What she encountered there was staggering. Thousands of black men, women, and children were sick, malnourished, injured, and traumatized. Many had never received professional medical care in their lives. Others had been refused treatment by white doctors even after emancipation. Dr. Crumpler treated anyone who came to her. She treated women during childbirth. She treated children suffering from infectious diseases. She treated elderly people whose bodies bore the scars of forced labor. She worked in conditions few white physicians were willing to endure. And for this work, she was met not with respect, but with resistance. Hostility from the medical establishment. According to records later preserved by the National Park Service, Dr. Crumpler faced relentless discrimination from white colleagues. Doctors mocked her openly. They questioned her credentials. They dismissed her authority. Some referred to her medical degree as standing for mule driver. Pharmacists refused to fill her prescriptions. Hospitals denied her admitting privileges. Male physicians attempted to block her access to patients. This was not subtle prejudice. It was systematic obstruction. And yet, she continued. She treated patients in their homes. She treated them in churches. She treated them wherever people would allow her to enter. Her commitment was not to institutions that excluded her. It was to the people who needed her. Returning to Boston. After her work with the Freedmen's Bureau, Dr. Crumpler returned to Boston, settling in the historically black neighborhood of Beacon Hill. There, she practiced medicine out of her home. She treated patients regardless of their ability to pay. This approach was radical. In a medical system already structured around profit and exclusion, Dr. Crumpler practiced on the principle that health care was a human necessity, not a privilege. She focused particularly on women and children, understanding that maternal and child health formed the foundation of community survival. Long before the term existed, Dr. Crumpler was practicing health equity, writing herself into history. In 1883, Dr. Crumpler published a book of medical discourses. This achievement cannot be overstated. It was one of the first medical texts written by a black physician in the United States, and possibly the first by a black woman. The book focused on maternal health, childhood illnesses, preventive care, practical medical guidance for families. It was written not for elite institutions, but for everyday people, especially women caring for children without access to doctors. In a society that denied black women authorship, Dr. Crumpler claimed intellectual authority. She wrote herself into the historical record when others refused to include her. Erasure after death. Rebecca Lee Crumpler died in 1895. Despite her groundbreaking contributions, she was buried in an unmarked grave. For 125 years, her resting place bore no stone, no inscription, no public acknowledgement. Her story faded from textbooks. Her name disappeared from medical histories. Her legacy survived only in fragments. It was not until 2020, amid a renewed national reckoning with racial injustice, that the city of Boston finally placed a headstone bearing her name. More than a century after her death, she was formally recognized. Why her story matters. Rebecca Lee Crumpler's life reveals a truth that still resonates today. Black excellence has always existed. What has been missing is recognition. Her story exposes how systems respond when black women break barriers, not with celebration, but with resistance. Yet despite mockery, obstruction, and erasure, Dr. Crumpler built a legacy that could not be fully destroyed. Today, black women physicians continue to face disparities in pay, representation, and treatment, but they also stand on the foundation she helped lay. Every black woman who wears a white coat today carries a piece of her legacy. a pioneer they tried to forget. Rebecca Lee Crumpler did not seek fame. She sought healing. She practiced medicine in places others refused to go. She wrote knowledge for people others ignored. She lived a life of service in a nation that denied her humanity. History tried to forget her, but truth has a way of resurfacing. Rebecca Lee Crumpler was not an exception. She was a beginning,